This segment of DelmarvaLife is sponsored by TidalHealth.
As technology improves, the old ideas of intense surgical procedures requiring manual tools and instruments continues to seem further and further away. Minimally invasive techniques are being developed to increase precision, reduce recovery times, and provide a faster and safer experience for both medical professionals as well as the patients. This especially applies to the field of urology. So with us this afternoon, this is Dr. Richard Batstone with TidalHealth Urology. Thank you so much for joining us today.
Thank you for having me here.
Wonderful to talk to you. Okay, start me off with this. Tell me what HoLEP is.
So HoLEP stands for Holmium Laser Enucleation of the Prostate. It's an acronym. And it's a procedure that was actually developed about 25 years ago in New Zealand by a urologist who's trying to mimic the open prostatectomy, where you would find the plane of the adenoma and shell it out with your finger, okay? You get a lot of bleeding with that, and as an open incision, but with a HoLEP, what you can do with an endoscope, a laser, specialized instruments, you can find the plane between the benign prostate adenoma and the capsule. And I have here a Satsuma provided by our nice cameraman. And if you can imagine, this is your prostate, and you are urinating through the middle of that. As you get older, your prostate enlarges. Right. And the idea of a HoLEP is to find the plane between, this is a kind of orange Satsuma, between the capsule, and essentially shell it out in this manner.
Oh, I see what you're saying. Okay.
Yeah. So, and you can do that with great precision with the scopes that we have currently, and the laser that we're using. And how is it different to traditional?
Yeah, I was going to ask that, yes.
How is it additional to some of our traditional procedures? So I'm going to include TURP, which is transurethral resection of the prostate.
Okay.
This is an electrocautery operation where we are resecting the prostate. So if you can imagine our orange, what we're doing is with a telescope, we're going through the central part and chopping little bits of orange out and trying to find the capsule. Believe me, if you have a very large orange, it's almost impossible to remove all of the tissue, and you'll get a lot of bleeding when you're doing that. Other procedures include green light laser treatment, where you're using a laser to ablate the orange and try and find the capsule. Again, you use a lot of laser energy when you're doing that. You don't remove all of the orange, and you're left with a lot of tissue left, in this case the adenoma.
Okay, so let me ask you this. Let's go back to HoLEP for just a second.
Yeah.
When should somebody consider that? Who would be a prime candidate for HoLEP?
I mean, a lot of people have enlarged prostates as they age. Not everyone gets obstruction from their enlarged prostates or urinary symptoms. But the bottom line is, if you have prostate obstruction, you're a candidate for a HoLEP. Okay. It doesn't matter what size gland you have, how big it is, how small it is, the HoLEP can treat it. But some of the common indications are retention of urine, the inability to urinate, recurrent urinary tract infections. I'm bleeding from my large prostate. I've got urinary symptoms from my large prostate. And those are some of the common indications.
So what does HoLEP mean for patients in our community?
Well, there are a lot of large prostates, and I'm surprised since my arrival how many men with very large prostates there are. And this is definitely the procedure of choice for the very enlarged prostate, because you just can't remove all of the tissue with conventional methods. So, and what does it mean for our patients here? We end up getting a lot less problems after their surgery. So you can have this done as a day case surgery. You're home, usually within an hour or two of the operation, with some minimal bleeding and minimal pain afterwards. So
some pretty incredible technology.
Yeah, and you can do it even with you have ginormous prostate, and you're on blood thinners, and you're really sick. So pretty well you can operate on virtually anyone.
Right. No reason to put up with it.
Yeah.
There you go. Dr. Batstone with TidalHealth, thank you so much for talking to us today. Greatly appreciate it.
Yep.